The U.S. has recorded more than 6.7 million coronavirus cases. And this weekend, we are expected to mark 200,000 deaths from the coronavirus. Right now, we are at more than 199,000 deaths. These numbers would have been unthinkable just 6 months ago, and now they are an everyday reality. After a wasted summer, returns to work and school are all happening in the shadow of the virus, and it apparently did not have to be this way. Months ago, the White House scrapped a plan to send masks to every household in America, according to internal documents that have been released to the public thanks to a Freedom of Information Act request. Instead, there were more than 600 million sent to nonprofit organizations and state and federal agencies. We do not know why the plan was thrown out, but we do know it was around the time President Trump publicly resisted masking. I want to bring in Dr. Vin Gupta. He's a pulmonologist, pandemics consultant, of course, an NBC News medical contributor. I have to say, Dr. Gupta, this was of all the crestfallen moments that I've just felt about the handling of this virus, this one was one that just hit hard because it was like, my goodness, the message this could have sent the country, not just in sending the actual masks, but the government sending you the masks. Dr. Gupta, do you think we can quantify how many lives this cost?
Chuck, you nailed it with that comment. I think it's the message it sends that's the lost opportunity. In terms of quantification, everybody's going to criticize models because the output is only as good as the input, but there's convincing evidence that probably 70% of lives could have been saved that have since been lost if we had an early shutdown. So 2 weeks earlier, 70% of lives would have been saved. If we added masks on top, this is what I can tell you, Chuck. I'm not going to speculate on what we could have done, but if we adopt universal masking right now, something the president 48 hours ago continues to make fun of, question the efficacy of, if we adopt universal masking right now, we could potentially save up to 200,000 lives, according to estimates from the University of Washington, by December 1. So this is serious. This isn't going away. And on the West Coast, at least, Chuck, we're talking not just about masks, but well-fitting, high-quality masks. That's the issue here. It's not just put a piece of cloth on your nose and your mouth. What's the type of mask here? We can't even have that conversation.
Hello, YouTubers. If you're watching this, it means you've checked out our channel, so thank you. Now do me a favor, subscribe by clicking on that button down there. Click on any of the videos to watch the latest interviews and highlights from MTP Daily and MSNBC. You can get more Meet the Press content every morning in the First Read newsletter. If you're tired of content that you don't know anything about where it came from, you don't have to have that problem with us. NBC News, MSNBC, MTP, and the Meet the Press mindset right here for you on YouTube. Subscribe now.